I also grew up with a mom with very serious mental illness, with bipolar disorder. I was in the home, as a young child even, and trying to access healthcare and support for her in the kind of fee-for-service world that I lived in. And, helping her navigate that had a very, very profound impact on me and my journey, because even at a young age, 9 or 10 years old, I had the recognition that something wasn't right in the way that the system of care was designed, especially for those individuals with limited agency or advocacy, or with complex mental health or social needs.
Will you still need me? Will you still feed me when I'm 64?
And now the podcast where together we discuss proactive aging on your terms, connecting to the professional advice of our special guests, while creating better days throughout the aging process. Now here's your host, Mark Turnbull.
Hello, everyone, and welcome back to another lively discussion on aging today. We are the podcast where together we're exploring the many options to aging on your terms. You can find Aging Today and our past 8 years of programs on our website. All you got to do is go to agingtoday.us. And then for all of you that have been listening over the years, there's countless of you. There's been, I've been told once, over 200,000 followers, and we want to say thank you. Thank you for tuning into Aging Today, because it makes a difference for us staying on the show, because this was a show that was designed to help people through the aging process, and it's daunting. There's so many questions that people have, and we want to know what your questions are. And if you have more questions, reach out to me, your host, Mark Turnbull. And my email is mark@agingtoday.us. It's Mark with a K at agingtoday.us. So we want to hear from you. And if you have aging experts also that you feel would be, interesting to hear on Aging Today, just reach out to me again, your host, and I will make sure that we get them on the podcast. Well, we all know that if you're not too busy being born, you're too busy aging. We talk about that all the time. It doesn't matter if you're 10 years or 110, we're all aging. And one of the things, as we are faced with an aging population, not only here in the United States, but worldwide, there are 1.2 million people, billion people that are over the age of 60. And in 2050, there's going to be 2.1 billion people that are over the age of 60. So it's here, it's prevalent, it's not just to the United States, but it's worldwide, and we're all faced with the aging issues. And what do we do with the aging population out there? And with aging comes many challenges. And one of those challenges that we're going to be addressing today is mental health and loneliness. And here to guide us down that road is Dr. Matt Patterson. He's the president of Welbe Health. So Dr. Patterson, what we always want to do is we want to start out with talking a little bit about you, and, when, you can go back as far as you want into your childhood, but we want to know what's in your story. What led you to become a doctor? And then what are you doing with that role as a doctor in our culture today, and especially in addressing mental health and loneliness?
Well, thanks, Mark. It's great to be here. And I think it's a wonderful topic, and happy to contribute any way I can. My journey for what I do today, which is as a president of Welbe Health, we care for very vulnerable older adults, those who might otherwise be in an institutional nursing home setting, and we provide kind of wraparound medical and social care that allows those individuals to remain home with greater dignity and independence. My background leading up to that really centers around just being aligned with the mission, and then also being aligned with how I could create a organizational culture that was really dedicated to that mission. I grew up as a Navy brat. I was born in a Navy hospital. I ended up practicing medicine in the Navy. And so I'm familiar with a system of healthcare, for lack of a better way to put it, is universal healthcare. Everybody gets it, and all the incentives are aligned to simply do the right thing for individuals. So that was a big part of it. I also grew up with a mom with very serious mental illness, with bipolar disorder, and spent time with her through some really, really challenging moments where she was psychotic or suicidal, and I was in the home as a young child even, and trying to access healthcare and support for her in the kind of fee-for-service world that I lived in, and helping her navigate that had a very, very profound impact on me and my journey, because even at a young age, 9 or 10 years old, I had the recognition that something wasn't right in the way that the system of care was designed, especially for those individuals with limited agency or advocacy, or with complex mental health or social needs. So those had a big part of me becoming a physician, as well as me gravitating to the organization that I'm at today.
Yeah. And I think I want people to understand, that's why I let out in the introduction about the vast volume of humanity that is in that aging process, and going into their 60s, and the whatever magical about the 60s and above is when we begin to see some of the declines that traditionally happen to the human body. And, when you think about, over 1 billion people that are going to be in that age category of 60 and above, that's just amazing by the year 2030. Then by the year 2050, it's going to be double that, 2 billion, over 2 billion people. What are we going to do? How are we going to address? I mean, it's daunting to think about how we're going to address all of the special needs, and in particular, mental health and the loneliness that comes with the aging process.
Yeah, you're getting at another element of the why around what I do today. I mean, our organization was founded by a group of physicians. They're all kind of mission-driven physicians, and part of just the magnitude of the challenge that you're describing was another thing which was very compelling, and a big call to service. When I think about the developed world, I feel this is the most important challenge of the developed world. The challenge of lonely, isolated, older adults using healthcare in really poor ways, in a poorly designed system, oftentimes with not the greatest outcomes and at great expense, is the most pressing social challenge of our time. If we were talking about the developing world, it might be different. We might be talking about other healthcare challenges like access to water and vaccines and medicines and things like that. But in the developed world, this is it. And so I feel as if over the next decade or more than half of our workforce is likely going to be employed either directly or indirectly in providing care and services for the cohort of individuals who are moving through the later stages of their life.
Yeah. So let's go into a little bit of your organization. And we were going to do this at the end, but I'm going to switch it up here, and let's talk a little bit about PACE and what it is, what PACE is an acronym it stands for, what it is, and it's a group of physicians that have gotten together, and what your organization is doing to address all of the issues. But then let's bring it back to specifically mental health and loneliness.
Yeah. So Welbe Health, we operate PACE programs. PACE stands for Program All-Inclusive Care for the Elderly. This is a national program in the United States that was started about 50 years ago, a little over 50 years ago, as a pilot in California. And it's designed for those older adults with very complex medical and social needs who would otherwise be nursing home eligible. By definition, have to be nursing home eligible or qualified And it just provides all the wraparound services that are required for that person so that they can remain at home, and aging in place. And so this is a program that has physical locations where participants come to and spend time at a couple of days a week. And then we provide home services as well, and basically access to care 24 hours a day. So it's physicians, nurses, dietary, mental health support, social work, physical therapy, occupational therapy, home health, home care, transportation to all appointments, transportation to and from our day center, delivery of medications to the home, really just kind of everything you could possibly imagine, one-stop shop. Most individuals who are in PACE in the United States are dually eligible, have both Medicare and Medicaid benefits. Although neither of those things are a requirement for PACE eligibility, nearly all individuals have Medicare and or Medicaid to be able to afford the program. The eligibility is to be 55 years of age or older, be eligible for nursing home level of care, and they have to live within the service area of a PACE program. We're currently in California.
But you can remain independent in your own home as well. It doesn't have to be.
Yeah, that's the whole point. The whole point is that we are caring for individuals before they're ending up in an institutional setting, so that we can keep them home indefinitely. That's the goal, is to keep folks home and cared for with greater independence. So Welbe Health is one of many PACE organizations in the country. As you mentioned, we were founded and were operated by physicians, which is a little bit unusual for PACE organizations. That's not always the case. So we're unique in that way, in that we have a particularly a focus on clinical outcomes and clinical care in a way that maybe some other PACE programs might not. But we do things in the PACE world very similarly to other programs, and that would include addressing the root causes of the things that we're talking about. It's addressing loneliness, isolation, need for socialization, all the things that are upstream of what could end up as more of a clinical manifestation of mental health concerns. So I'd be happy to talk about any aspect of kind of what the PACE model does, what Welbe Health does, because I think that could be helpful as an example for what other organizations might be able to do to help address the challenge.
Now, where is Welbe Health located, geographically?
We currently operate 10 locations in the state of California, as far north as Stockton, California, in the Central Valley, Stockton and San Jose, and then as far south as Long Beach, and a lot of places in between. A lot of centers in the Los Angeles area, Central Valley, and Bay Area, and then we are approved to launch a PACE program in Brooklyn, New York next year. So that'll be our first operation outside of the state of California. And PACE at large is open and live in, I think, 33 states now out of 50 in the United States.
Mm-hmm. And it is the application to PACE. You've got a physician-led team, so it's going to be maybe implemented a little bit different than maybe somebody else that's using PACE in another location and not so physician-heavy, or how do you get how do you scale that, so that people get the same, level of care?
Yeah, PACE is a highly regulated and regimented care model. Yeah, it's 50-year track record of just delivering, outstanding outcomes on what is known as the triple aim. So outcomes, access, and cost of care. So PACE has a really well-established track record of keeping people home out of the hospital, keeping people with a very, very high quality of life and satisfaction with their care, and then costing taxpayers less money than they would otherwise spend for older adults to be institutionalized in Medicaid nursing homes. We operate PACE according to the same rules and standards as every other organization in the country. So there's nothing different in terms of the way somebody might access the program. If you live in the service area of a PACE program, and you can find those on National PACE Association. So this will be a non-plug. This is just for education. The National PACE Association is a not-for-profit trade association that that is advocating for PACE, you can access their website and learn where there are PACE programs. So if you're in the location of a PACE program, you're aged 55 years of age or older, and you meet eligibility criteria in that particular state for nursing home care, then you're qualified for PACE. Most PACE participants who enroll, like I mentioned, will be duly eligible. They'll have both Medicare and Medicaid benefits, which cover the cost of PACE. And most individuals who enroll in PACE have no share of cost whatsoever. So it's completely no cost to them.
What's the main driver that seniors are utilizing PACE for? They get to that place in their lives where, they're feeling out of control or loss of control, and feel alone. They don't know what to do. They need assistance. I mean, walk us through that scenario.
Yeah, I think oftentimes it can be an older adult who has the recognitions that you're describing, or it can be a caregiver, a family member, son or daughter or caregiver who's close to that individual, who might be feeling just the inability to handle the burden of the day-to-day care that's required to keep that person home. I think also, Mark, there's just a more of a cultural phenomenon that I see happening now, where autonomy and agency is even more important to the older adults in our culture today, perhaps even more so than longevity. I don't have any hard data to back this up, but as a physician and going through training and learning about this over the years, I just feel as if there was a point at which individuals stopped caring so much about surviving. If you think about the ICU generation of care, the space age care, of like doing everything that was possible, just keeping people alive, and that was so highly valued. My sense is what's valued much more today is living life the way you want to live life. We're all here because we want to be who we are. That's the most important thing we'll ever do in our life. I tell our team members that all the time. The most important thing that we will ever do in our lives is to learn how to be who we are. And ultimately, I think that comes down to one thing, and that's love. I think to be who we are is to feel loved, and to love others is to be love. And so having agency and autonomy and calling things the way you want them to happen is extremely important. And that's where I think PACE is just this amazing model that's been around with a great track record for a long time. And people are really realizing, oh my gosh, here's this thing that's existed for a while that's available that'll allow me to live life on my own terms in a way that I might not otherwise be able to do. And it can help alleviate some of the caregiving burden that some of my family members or caregivers have been shouldering for a while. So I think that's what really, I think we see brings people. And we get referrals like other PACE programs do from, housing operators of assisted living, independent living locations, or community care organizations, social care organizations, all of those individuals, or agencies, I should say, looking out for the needs of older adults with complex needs.
Yeah. If you were to rank the reasons why people reach out to you at Welbe Health, and what would the conditions be in maybe the top three?
Yeah. So provided somebody is eligible, and you're saying, well, why? What brings you here? Why would you even be interested in PACE?
Yeah.
I think that it's one-stop shop. Is key. That it's not just a medical model. There's just a host of social resources and just daily life resources with that's very important. So one-stop shop. The second is I want to stay home. And the third is I'd like to have help beyond those who I've been relying on most, a caregiver or something. I think that's really it. Here's a place I can get everything I need. I can stay home because I don't want to leave my home, and I can make it a little bit easier on those around me.
Yeah. Yeah. Well, and that's one of the things that we do too. I own an in-home care agency and a hospice agency, and we have a continuum model, and the idea is to keep people independent in their own home and living their life to the very
Yeah.
end, whenever that is and whatever that means to them. And you just need that assistance. And my biggest concern, and I don't know if this is something that you guys have addressed, in order to stay at home, it is so costly for professional services from caregivers, from agencies, much like my own, where it's just prohibited for a lot of people to remain independent in their own home. Is there any conversation about how we can make in-home care more affordable?
I think that's a big opportunity area. I think for us and what we do, we include. I mean, that's included in our services. So whatever skilled or unskilled need that's needed in the home, we provide that. And unlike a lot of PACE programs, we insource it. So Welbe Health insources. We have our own home health and home care team. We don't contract out with other organizations, which some others do because of their scale or their need. And so but what I think the big opportunity is, it's around those individuals who don't have that as a covered benefit, yet they don't have enough, they have too much income or assets, that they don't qualify. So this is, I mean, I'll be careful here. Now we're getting on a completely different thread, but I mean, I think we're a little bit
I like
overdue.
those rabbit holes.
Yeah. We're a little bit overdue for kind of like a big Medicare event. Another wave of like a big Medicare type of reform I could see happening at some point, similar to what happened with the Affordable Care Act, just like a big thing. And I think what that would have to include is it would have to include long-term care type supportive services eligibility under the Medicare benefit.
Yeah.
For those individuals who are stuck in what I would call the in-between zone. I have too much that I don't qualify for Medicaid, but I don't have nearly enough to be able to afford out of pocket the type of home health or home care services that I would need to stay at home. I think we need to address that. I'd love to see PACE eligibility expand to those who just have Medicare only and have it be more affordable. I'd love to be able to find a way that Medicare benefit could cover some of the in-home needs that organizations like you have that could provide that safety.
Yeah, and that's where the middle class are the ones that are losing out. It's the low income and the top echelon, the 1%, are getting cared for. Either by themselves or through Medicaid or Medi-Cal, whatever state you're in. And it's the middle class that have too much money, too many resources to qualify for assistance. So we do need to figure this out. And that's not the scope of today, but I thought it's an interesting, I was curious what it was that you guys were thinking, because I know it's probably, hot and heavy on your hearts and minds as well as you hear from people. When our seniors are aging and they get above that 60 age group and above, and I'm personally taking care, moved in with my mom and dad back into the home that I grew up in, and my wife and I are living in the bedroom that I grew up in, and we're making sure that dad has since passed away, but mom is living her life the way she wants to live it. And as I've watched her age and have watched her progressively losing more and more of her independence, if I wasn't here, and again, I'm not, bragging about myself, but I'm just saying if I or another family member wasn't there for the seniors, it's got to be just the scariest thing. And I can't even imagine what the thoughts, that would go through her head if we weren't here. And not everybody has that luxury of doing what we're doing. And I'm not advocating that a lot of people do that. I'm highly skilled. I'm a paid professional, right? But, if you can do it and you can provide that type of care, that's great. But for those that don't, it can be lonely. And that loneliness leads to a lot of other symptoms of depression and anxiety, and that's part of the mental health. Talk a little bit about what you're seeing out there and what you're doing to address mental health and loneliness.
Yeah, I mean, I don't think I could explain it any more personally or effectively in terms of what the situation is than you just did. I think what I'm reminded of is I studied psychology as an undergrad, and so one of my early heroes was Carl Rogers, who invented kind of a pioneer of patient-centered therapy and empathetic listening. And one of my favorite quotes of his is he said, "What's most personal is also most universal." So you're describing this thing that we all have in common, no matter what. We're all going to age. We all have loved ones who are facing this. I was kind of front row seat to a more extreme version of this, in that my mom had very serious axis 1 illness, and that it manifested in very extreme ways, but in a much more subtle and pervasive way. I watched her loneliness set in over the years of her life. And I mean, there's all kinds of just very, very clear evidence on the impact that this has on people's physical health, and also on the society burden and cost of care broadly in the United States. I mean, I know you have an international audience here, and I think one of the things that happened in COVID was that it somewhat highlighted the weirdness by which we operate in this country, in the United States. I mean, we have a bit of a strange model in that, we have young adults who just leave the home very early, and that's championed. Mm-hmm. And we really don't see a whole lot of intergenerational households as a norm. That's fairly uncommon.
Yeah.
And then we also have this model that's fairly common to have individuals end up in kind of institutional settings in their later life. And I think the COVID pandemic really amplified that, and kind of the international community, I think, saw just the extent to which that happens in the United States. So unless we're going to have a societal moment to undo all of those trends which have been taking place over the past 200 years in our country, we really don't have any other choice than to be able to develop more effective models to address it. And so I think it's gonna depend on the social services and the safety net that are part of our societal contract in the United States. Mm-hmm. PACE being one of them, and other Medicaid qualified programs are another. So the answer is is not really, it's not that complicated. They're executing it and having the resource to execute it. That's where things get challenging. And the answer is high touch. The answer is time. The answer is being with somebody and listening to them and wanting to hear their story and their needs and what they want to get out of life, rather than imposing a paternalistic, highly medicalized orientation towards, we're going to make your glucose this, your blood pressure that, and your cholesterol that, because that's what's going to save taxpayers money. What does an individual want out of their life? What are they trying to achieve? How do they want to live every day? It's having the time in the model to listen to that and care for that and advocate for that. So, I mean, I feel really lucky that I'm in a model that gets to do that. It's resourced accordingly, that we get to do that. I mean, we get to spend a lot of time with those that we care for, and I really wouldn't have it any other way. So I think you're gonna see a lot more programs like PACE and PACE Expand, or like I mentioned, there's going to have to be a societal moment of just expanding the benefit definition that we typically equated with low income. And instead, we need to start equating it with older age. Yeah. The risk is not being low income. The risk is being older and isolated and lonely. And I guess a little bit of a contrarian thing. I mean, we're a fairly innovative organization. I come from a technology background as well, but I'll probably say that I'm a bit almost disheartened by some of the over optimism, I think, on some of the technology front in terms of solving loneliness for an individual. I think it can certainly help. I think there's certain things with, companions and artificial intelligence that can help. I've seen some really interesting programs that I think are very good, but ultimately I think that we really just need more human compassion and touch, and society's going to have to pay for that if we're going to continue down the road that we've been on of promoting young adult independence from their parents and grandparents.
Yeah, I would agree with you. I think there needs to be a higher touch approach to our care than even what we've been giving. And I'm all about technology. I'm all about AI, but I think it's limited, and it really comes back to the human touch.
Did you know that seniors enrolled in the PACE program experience 24% fewer hospitalizations compared to those in traditional care? By coordinating all aspects of a senior's health, PACE helps reduce emergency visits and supports seniors in staying healthy and independent at home. Discover more at welbehealth.com. This Did You Know moment is brought to you by this week's guest, Welbe Health, and our sponsor, Royal Hospice of Oregon.
As you approach mental health, our culture is changing in its attitudes towards mental health, and in particular to seniors. There's lots of different levels or ways to approach mental health, but from our elders, from their perspective, as they age and there are mental health challenges, how would you define that? And so let's just start there. How would you define that? What does that look like?
Yeah. So, probably the best way to, I think I'd probably explain it more in towards of how would you, in an ideal world, how to go after it in a way that promotes better health for everybody. Mm-hmm. Step one is listen for it, informally or formally. And so the nature of screening is extremely important when it comes to any care model or program, or even just informal interaction that we have with each other. It's listening for it, it's asking about it, and then being okay with whatever answer comes out of just being with that, not necessarily having to fix it in a moment, asking somebody how they're doing, and then catching yourself and pausing and saying, wait, let me just take a breath. How are you really doing? How are you really, how's it really going? And just slowing down and allowing for whatever answer emerges. That's the informal thing that we could use a lot more of in our society. And I think we're seeing good role models, in public settings and athletes and things like that, being more forward about speaking about how they're really doing. So I think that's the informal. In care models, we have to listen for it more formally. We have to screen for it. And then we have to follow up on the things that we find. Oftentimes it's addressing some of the risk factors without jumping right into a medicalization of what's going on. And so for us, it's addressing the loneliness. And so it's engaging with those that we care for on a daily basis, even if it's just by phone call or a video conference on a digital device. But better is bringing folks into our centers, 2-3 days a week, where they can socialize and hang out with other participants and engage in activities, engage in music and dance and cooking and art and just conversation and just being a part of a community is just a massively important thing in all of our lives as social animals. And so that's a big part of what we do is to engage.
The other thing I was going to suggest too is that, rightly so, some of the therapies or some of the things that you can do to combat against loneliness is, being more social, going to the senior centers and things like that. But for those seniors that are not as mobile, one of the things that I've done with my mom in the home is oftentimes we'll have I just turn on the music. I turn on Spotify. I play music from her day, and she gets up and she starts dancing. And it's incredible. But those are the types of things that we can do. Some of the really simple things. It doesn't take a lot of mobility, going outside the home, but you can stay in your home and engage our seniors with those activities.
Yeah, I think that's great. And those would be the places where actually I do, I am a fan of some of the technology answers that really help, especially when they're done in combination with, a phone call or a visit from a loved one. But yeah, my mom, I fortunately caught her early enough to get her socialized to using, an Alexa device to play music. And so she has that interaction and that ability to kind of engage with something that's soothing or feels good or familiar, especially as her memory has gotten significantly worse, and her cognitive function has got where she still has the ability to interact with that device, and that can be a very helpful coping mechanism. But yeah, calling, using FaceTime or video conference is a really effective way to bridge the loneliness as well. If programs are not available or people are limited in their capacity to go out. But yeah, I think a huge part of it is time to listen and engage and not try to fix where somebody is at, and just kind of be with where they're at. Yeah. And that just takes some patience and time.
Provide as many meaningful activities as you can. And, some of the other things that we've done is, she grew up playing solitaire with her dad. So one of the things we've been doing to keep her mind active is to, see the cards, the numbers, and, all the sequence and the cueing and all those things. And I have to do a lot of cueing with her because her mind is not as sharp as it used to be, but she can still do those activities, which is really kind of cool.
Yeah.
So with the signs, so if as an adult child to mom and dad that are in their 80s and 90s, what are some of the early warning signs that we should be noting and looking for to say, whoa, mom's mental health is not as strong, or maybe there's some, as from a physician's viewpoint, that you can train and educate us on things that we should be seeing?
Well, I think, without trying to get overly clinical, I think that, it can, if you're talking about mood, either depression or anxiety, which are probably among the most common things that you'll see when somebody's mental health is suffering. I think it starts honestly by creating the space to notice. And so I would just urge everybody to start there, rather than looking for any one particular sign. Instead, maybe having a practice of being active to engage with it, to just provide more space for the vulnerability to share it. Yeah. So people's parents may not be comfortable sharing how they're doing, or feeling like they're a burden, or not wanting to worry anybody with how they're doing. And so just getting in the habit of creating the space to ask how somebody's really doing, and just being real slow with the answer and real patient, and just providing time to allow somebody to expand, ask open-ended questions, and just, hey, tell me a little bit more. Tell me more what you're thinking there. And then, as that emerges, then the things obviously to look at are just the signs and symptoms of those things, which is, just feeling down, depressed mood, or lack of energy, or sleep disturbance, appetite changes, losing interest in things that used to be very fun and engaging, just not having as much interest anymore, avoiding certain things that used to be a source of pleasure. Those would all be like the
I think that's a really good list of things that people should be observing when they're around their moms, and especially around the holidays, because a lot of people, the adult children are absent from their parents until the holidays come. So we see a big uptick in phone calls that, hey, mom and dad need more assistance after we've spent some time with them. And some of the things that I often hear is that, wow, mom has really declined in the way she dresses and her appearance. She's not combing her hair. I mean, there's all kinds of, the litany of lists that you were just citing that we, as adult children to mom and dad, looking for those signs, those symptoms that are alluding towards mental health or that loneliness and depression.
Yeah, and it's also something where like you're mentioning, the stigma it's decreasing even among the medical set, and so to the extent that a loved one, an older adult, has a trusted provider, a doctor, nurse practitioner, or something like that, enlisting their support in it, that can help your loved one, your older adult loved one, let their guard down a little bit. They might be more willing to share something with another individual that they've had a long relationship with, and your role as a loved one can simply be to provide some corroborating evidence or concern, and give your the older adult permission to kind of let somebody know how they're doing.
From a very practical standpoint, I was thinking, and again, you're a physician, and as laymen out there that, are living with mom and dad or observing from a distance what's going on, some of the mental health is conditions that we need to be watching for. And I think one in particular is anxiety. When you see those anxious moments in mom and dad, share with us a little bit about how you would coach us up on how to deal with anxiousness.
Yeah, this is it's so funny. We're hitting on all these symptoms of, in my mind, just kind of a society that's in many ways asking for it. I mean, I'm surprised people are not more anxious, quite frankly, just given just the freneticness of the way information and distraction and multitasking and sound bites come our way. We live in this extremely short attention span world, and I think with that you're gonna just see a lot more anxiety that exists. It's very difficult to cope and keep up with that. So I think my first rule of thumb would be similar to what I mentioned on a depressed mood, which is simply take a breath yourself. Yeah. Take your own pulse first. And just one of the most important things that you can do for somebody who's, suffering from any kind of emotional, upset or feeling disease, is just to allow space for vulnerability. And so that requires you to simply be slow, listening, open, grounded, and just resisting the urge to minimalize it out of good intentions. Oh, it'll be okay. Everything's going to be all right. Don't worry about it. It's going to be fine. Yeah. Those are not necessarily going to be the most helpful things. Your ability to just be with where a person is at and listen. Tell me more. Tell me more how you're feeling. How did that affect you? Tell me more. And just listening, asking open-ended questions, and allowing a person to process a little bit, that'll just go a long way to understanding, first of all, the depth to which somebody's experiencing anxiety. It may be something that's very, very explainable and related to something that's real, and you'd be just as anxious. Or what you might discover is that the feelings, to even like a typical person today, society, might feel disproportionate to the stimulus. In other words, the feeling of anxiety might be somewhat, wow, that's at odds with the thing that you're looking at. Then that would be a trigger to say, hey, something might be going on here, where I might want to get some help. And again, that's where you can make that connection to a trusted professional to get a further assessment.
Yeah. Yeah. I think a couple other things that come to mind are, alcohol. And, because I think when sometimes we get depressed and we're lonely, we can resort to things that are going to cover up those things that are going to help us to quote unquote feel good. It may be for the moment that you feel good, but when the hangover doesn't work as well in helping you to feel any better. And then you got all the complications with medications on top of that. So
Yeah.
how would you counsel an adult child of mom or dad that is suffering with mental health issues or that depression and that loneliness? How would you go about addressing, substance abuse?
Yeah, well, there's substance abuse or just even casual. I mean, so I would just say, just from a clinical standpoint,
Yeah.
I have no reservation of saying that alcohol has no place in a person who's prone to anxiety. I mean, I
Yeah.
just could be unequivocal about it. There's no amount of good alcohol in that circumstance.
Yeah.
It will not help. It may, and so I would say avoid that one. And I think if there's, more on the spectrum of somebody who is prone to abuse alcohol or has a dependency on alcohol, that is one where you want to get some professional help, for that. Don't take that on alone.
Yeah.
Something I didn't mention before, and just, how do you handle anxiety when it comes up? I failed to mention, feel free to also just rely on yourself, standard logic of human common sense of re-engaging with the person that you're with and something that can soothe them. Music, an activity, something you can do together that's less stimulating. Go for a walk, touch. Any of those things can be tremendously helpful and doesn't require any training whatsoever to just be kind and loving.
Just be there. And then I tell that to caregivers and to nurses all the time. The number one attribute of a great caregiver / nurse, CNA, whatever you find yourself, or even an adult child as a caregiver or a spouse as a caregiver, number one thing, be present. Just be present, and then put yourself in their position so that how would you want to be approached? How would you want to be treated? How would you want to be talked to? How would you want to be engaged with activities? And that's what I often do with my mom. I just sit there and I put myself in her shoes. And then obviously I've known her for 67 years. And with that comes, some things that I can draw upon to help her live her best life possible.
Yeah, it makes a lot of sense.
Yeah, and it really comes back to the high touch approach to care that you've been talking about. Just being present and then finding ways to find high touch approaches to the care. One of the other, and I want to talk one more little item about depression and loneliness, and that is isolation. And one of the things that I think is a myth, and I've seen this over and over again, is when mom and dad are living in an assisted living community or any kind of a community, that doesn't necessarily mean that they're going to get and be surrounded by all of the different, factors involved with being engaged in activities. You can be just as isolated in those rooms as you could be if you were staying in your own home and isolated from friends and family around you.
Yeah, that's true. And I think, my mom has been in an assisted living setting. She's in New Hampshire, where she lives. And, it's a great environment. It's very safe. It's very caring. But she's prone to isolation and will do that even as a coping mechanism that she thinks is the right thing to do. So it oftentimes requires active engagement to kind of help bring somebody out of what their comfort zone is to do. So I think,
and then I think as an adult child of mom, dad, if you're in a community of some kind, or even if you're in your own home, you need to make sure that in an adult care community, that the activity directors and all the people that are there caring for mom, dad, that they're constantly knocking on the door saying, hey, let's get engaged here into the community. Because I think communities are doing a better job of providing those activities, but it's still hard to get people out of their rooms. And especially when you're in a mental health state of depression.
Yeah.
And that's the challenge. And from a physician's view, how do you approach that? How do you coach me up? How do you coach communities up to help them live their best lives possible when they may not feel like that they want to do that?
Yeah. And this is where you have to try to recreate, to the extent that you're able to, the best version of an interdisciplinary team that you can. In an ideal world, everyone who's at risk, older adult, especially those living alone who are, isolated, ideal world, everybody would have their own interdisciplinary team at their disposal. They'd have a primary care doctor, they'd have, a home care assistant, they'd have a social worker, they'd have a dietary assistant, recreational therapist, et cetera, right? So you have to understand that the right answer to the situation you're describing is hard to address without an interdisciplinary approach.
Mm-hmm.
And so I think sometimes you have to start piecing those things together to create that for your loved one as best you can with the resource that you have. And I would say that if somebody, has a mood disorder or a condition that they're so debilitated that they really don't want to engage on the things that would otherwise lift them up, getting out of the house, exercising, diet, all of it, is just unwilling or unable. There is there's an obvious place where a clinical model makes sense and can really help. I'm not advocating that we go and just try to medicate everybody and say that's the answer, but oftentimes you have a bit of an activation energy that you have to get over. That this is required, and so don't be afraid to get some help, and potentially even if your first step is medication, that might be at least the most accessible one that you have at your disposal, quite frankly, given the culture that we live in, and the least expensive one as well.
Mm-hmm.
But that might be able to, at least within 4 weeks or 6 weeks, you start to get a little bit over just that initial barrier of resistance. And then you start to create the other elements of your interdisciplinary team. What are the social needs that are absent? What's the engagement that otherwise would help, feel better? What's the exercise that's reasonable that could get accomplished? What's the dietary changes? You got to start trying to bring those supports in as best as you can. And provided those things go well, oftentimes you find that you don't need the medication as much or any more, and you can kind of work that way off. But sometimes you need the help just to get over that.
There's a holistic approach to the mental health and the loneliness and the depression that people are feeling. And I'm glad you said something about diet, because diet can play a huge role in somebody's well-being mentally. And I want to conclude with this one last question that I have, from a layman's perspective, and the question that I have towards a doctor of your esteem. How's that? It was pretty good, wasn't it? But a lot of times people come to me and they say, Mark, I don't know how to have this conversation with mom. I don't know how to have it with dad. I don't know how to have a conversation about their mental health and addressing whatever mental health state that they're in. How do you do that? How do you coach people up, or how would you do it? Give us an example. Do you have any stories that have been helpful to you that others have learned from?
Well, I'm reminded again, what's most personal is also most universal. And what you said, which is, how would you want to be treated in that moment? I think the answer is there for all of us. We all want to feel loved. It's pretty universal.
Yeah.
And oftentimes the way to do that is simply to just allow for the space to be, Can you just provide a space where people can simply be who they are? And so
Yeah.
you don't necessarily have to talk about mental health or your mood, or are you depressed, or are you down, or, are you lacking energy? It doesn't have to be a third degree. Can you simply just start practicing the space for somebody to say what's on their mind and how they feel, and watch what happens next? Watch what you do. Do you often find yourself say, "Oh, it's okay. Oh, you're not, it's all right. It'll get better tomorrow. Oh, don't worry about that." Just try not doing that. Just start there. Just start allowing for someone to just be where they're at and just ask a question. Tell me more. That's it.
Yeah.
Start there. You'd be amazed what'll happen. I think that there's probably just like an inordinate amount of reasonable guidance online, and, health plans and tutorials and videos of how to have a conversation with somebody about how they're doing. Avail yourself to those things. But I think it ultimately comes down to simply allowing somebody to be who they are in the moment, and not trying to edit that. Just be quiet, ask some questions and listen. Just the power of listening to somebody is very profound. And honestly, what came to my mind when you first asked me the question, I remember, being in the Navy young on active duty, and I trained as a diving medical officer. So I had to become a Navy diver. And one of those things is you have to be able to do a certain amount of pull-ups, and I wasn't necessarily a great person at pull-ups. And I'll never forget somebody who was helping me get in shape to become a Navy diver. And I just said, "Well, how do I get good at doing pull-ups?" And he said, "Well, just do pull-ups." So that's really what comes to mind. I mean, how do I get good at having a conversation with somebody about how they're doing? Well, try having a conversation with somebody about how they're doing.
Yeah.
And, I think it'll go okay.
Yeah. And I think I loved your answer. And it goes back to being present. It goes back to we're not calling everybody out to be approach loneliness or mental health from a clinical position.
Yeah.
Just be yourself and show the love and show the support. The high touch approach to care is so important. And, if mom's feeling a little depressed, maybe it's appropriate, turn on a little bit lively music, some music of our past, and then ask her, how does that are there any memories, Mom, that this song can bring up? And it's called redirection, but you can do that through various techniques. And we're not asking anybody to approach it from a clinical viewpoint. Well, I'm sorry to hear, Mom, that you're going through mental health and that you're depressed. I mean, how depressing is that to hear that from that approach? But when you approach it from a very practical side, sometimes what I'll do with my mom is, as she's sitting in the chair, is I'll just have her reach up into the sky and just put her hands together in prayer position, and then just reach as high as she can. And that generates the blood flow and the oxygen. And it's just as simple little things like that can be, profound in their day.
Yeah. Meaningful time, healthy food, going for a walk, movement. Yeah. All of these things are great ways to start building the space where somebody can share where they're at and how they're doing, and do it in a way that doesn't, like you say, pile it on and progress it. It's okay for somebody to share how they are, and not have to, tell them that they're not feeling that way, but you can also do it in a way that allows them to feel better.
Yeah, absolutely. Dr. Patterson, is there, if people that are listening to this program and they want to hear more from you and what, Welbe Health is doing and how they could maybe learn from what you guys are experiencing, what's the best way to connect with you?
Oh, I mean, anybody who's interested in, in me and what I'm trying to accomplish, with caring for older adults and doing it through the PACE model, you always get me on LinkedIn and just reach out to me. I'd be happy to engage with anybody. Those interested in Welbe Health can obviously just go to our website, welbehealth.com, and learn more about what we're doing. But yeah, I more than anything, I would just urge everyone to just be aware of the PACE model of care, program all-inclusive care for the elderly. That's not a plug for me or for Welbe Health. I just think it's an extraordinary model for the right people. And you may be surprised that you have this program that's available for somebody, for yourself, or somebody you care about. And so I'd urge you to, look it up in Google PACE, or look at the National PACE Association website for information about PACE. It could be something that could be helpful for you.
All right. Dr. Patterson, thank you for being on Aging Today. You
Mark,
were a
my
wonderful
pleasure.
guest, and we appreciate the wisdom that you brought to the table today in our discussion. And we hope that many that are listening out there that are suffering with mental health disorders, whatever that may be, whether it's depression or anxiety and loneliness and on it goes, we hope that you'll reach out to get some help that you need. And again, thank you for being on Aging Today.
Thank you, Mark. It was a pleasure. I hope I was able to help any of your listeners. So thanks for having me. It was really great to be here.
I'm sure you have. Thank you so much. I learned a lot as well. And this is Mark Turnbull, your host, and I want to thank all of you for tuning in to Aging Today. We are the podcast where together we're exploring the many options to aging on your terms. And remember this, we're all in the process of aging, and as we age, we really are better together. So stay young at heart.
You make me feel so young. You make me feel like spring has sprung. And every time I see your face, I'm such a happy individual. The moment that you speak, I want to go play hide and seek. I want to go and bounce the moon just like a toy balloon. Well, you and I are just like a couple of tots running across the meadow, picking up lots of forget-me-nots. So you made me feel so young. You made me feel there are songs to be sung, bells to be rung, and a wonderful fling to be flung. And even when I'm old and gray.
You've been listening to Aging Today, where together we explore the options to aging on your terms. Join Mark and his guest next week for another lively discussion on proactively aging on your terms, connecting you to the professional advice of his special guests, with the goal of creating better days throughout the aging process. Your host has been Mark Turnbull. Join Mark and his guests every week on Aging Today, your podcast to exploring your options for aging on your terms.
And even when I'm old and gray, you make me feel the way I feel today. 'Cause you make me feel so. You make me feel so. You make me feel so young. So young. You make me feel so young. You make me feel so young.